In the fascinating landscape of medical oddities, there is one case that defies common sense and baffles even the most seasoned experts in the field. It follows Charles Osborne, a humble American farmer who finds himself in a true physiological mystery when his life takes an unexpected turn when he is struck by a seemingly everyday attack of hiccups. However, it became a constant companion and he clung to it endlessly for 68 years. Today in Extraordinary Walks we tell you the story of a man trapped in the battle against his own body, a story that defies understanding and forces us to question the limits of science and human nature. Hiccups, although annoying, are usually a temporary discomfort that disappears on their own in most cases. However, the case of the American Charles Osborne demonstrates a surprising exception. This young farmer experienced an attack of hiccups on June 13, 1922, which persisted uninterruptedly for no less than 68 years. It was in February 1990 that the hiccups suddenly stopped, perplexing doctors and experts alike. During his lifetime, it is estimated that Osborne suffered around 430 million episodes of hiccups. Despite this chronic condition, she managed to lead a normal life, marrying twice and raising 8 children. Despite seeking medical help, none of the doctors could find an explanation or solution for his problem. Osborne suffered from what is known as chronic hiccups, a condition characterized by persistent episodes lasting more than 48 hours or even more than a month, and which are untreatable. In such cases, it is crucial to seek medical attention, as chronic hiccups can be an indicator of an underlying disease, such as central nervous system disorders, diabetes, previous surgeries, acid reflux, stroke, or even cancer. According to recent studies, 80% of patients with chronic hiccups had esophageal or stomach abnormalities, and 2/3 of these cases were amenable to treatment. Be that as it may, the case of the American Charles Osborne is truly remarkable. He experienced an episode of hiccups that began in 1922 and persisted until 1990, a year before his death. Despite seeking medical attention, professionals were unable to find a definitive explanation for his condition. But what is it and why do we have hiccups? Hiccups are the result of a series of spasms that affect the diaphragm, the muscle that separates the lungs from the stomach and plays a crucial role in breathing. This phenomenon occurs when the diaphragm becomes irritated and suddenly contracts between 2 normal breaths, generating the distinctive hiccup sound. While hiccups can be caused by more serious medical conditions, such as brain injuries, nervous system disorders, or certain types of cancer, in most cases, the causes are harmless. Excess food, swallowing air when chewing, alcohol consumption, or stress are some of the common causes of hiccups. Although hiccups usually go away on their own after a few minutes, many people find this sensation unpleasant and numerous myths have emerged about how to get rid of them. Despite their generally harmless nature, hiccups can be bothersome and persistent for some people, highlighting the need to better understand this phenomenon and explore effective strategies to alleviate it. But what are these effective strategies? It's true that hiccups can be a persistent and sometimes challenging discomfort to relieve. Over the years, numerous home remedies and techniques have emerged to try to stop it, but none offer a foolproof guarantee of success. Among the most common methods are the scare remedy, drinking cold water, gargling, breathing into a paper bag, holding your breath, and even hypnosis or acupuncture. However, the effectiveness of these methods varies widely and there is no strong evidence to support their effectiveness in all cases. Recently, a special straw called HICCUP, designed by a neurologist, has been developed and has shown some promise in early studies. According to early evaluations, 90% of people who tried it considered it to be more effective than any other home remedy. However, more research is needed to confirm its effectiveness. Ultimately, the easiest and most common thing is usually to simply wait for the hiccups to go away on their own, although for some it can be a frustrating and long wait. Fortunately, most cases of hiccups do not last as long as the surprising case of Charles Osborne, whose hiccups persisted for almost 68 years.